Hello everyone, welcome back to the channel. In today's video, I'm going to be showing you my rehab program for recovering from non-specific shoulder related pain. Also can be called rotator cuff related pain or subacromial shoulder pain. What we're not calling it anymore is shoulder impingement. And if any of that is sounding confusing to you, I encourage you to click the link up the top here and go back to the first video, because this has been a series of 3 where we went through what this injury is and why it happens. We then went through the literature to find out what the recommendations are. And now, based on all of that, I am giving you a rehab program that I have created on top of that, with a few additional adjuncts that will help you with this type of pain. Just a quick overview of how we've got here so far. I'm not going to explain everything, but I'll just go over the area. So it's called non-specific shoulder related pain, because the pain can be sourced from a lot of different areas in that region, and we call it the rotator cuff region. You've got the 4 main muscles, which we spoke about earlier: your supraspinatus, your infraspinatus, your subscapularis, and your teres minor. Plus, you also have the long head of your bicep tendon that's coming up in here as well. And you've got the humeral head and the acromion of the shoulder there, and it's sitting in that space. And there's also the subacromial bursa on top of that. So there's a lot of areas that can be the source of pain, and it can really be coming from any of them. And we know that these tendons of the muscles can get thicker, and sometimes there can be swelling, and sometimes the bursa can be a little inflamed, and lots of different things can encompass this pain, and it can change a lot over time. We spoke about at length what the main causes typically are, but again, just to touch on them, it typically involves an overuse, so maybe too much too soon. Maybe you just started going to the gym and you lifted too much, or you had a sudden increase. Or typically what I find is that people who have a lot of manual jobs that are very shoulder dependent, that's where this type of pain can be common. So maybe someone who's cleaning all the time, or in any kind of construction job or whatever, and you take that and you also apply some stresses and pressures at home, that's usually a good recipe to develop this type of pain. And in this video, we're just going to go through exactly what type of rehab program you should be doing to help recover from that. And like we spoke about before, strength and conditioning is the best thing. Muscles and tendons and in here. So what we want to do is we just want to target them and strengthen them. But that means strengthening them correctly, which is a big thing on this channel. Is if we do an exercise, we want to do it right. And that is what I am going to explain to you in this video. So there's going to be 4 exercises, and I'm going to show you beginner, intermediate, and pro for each one. So before we do the 4 exercises, let's just talk about, again, the theory about how to actually build strength, because that is the most important thing. And I don't want you to waste your time here. So to build strength, if you are a beginner to an intermediate, which most of you will be, you need to do anywhere between 25 and 45 repetitions per muscle group to achieve strength gains. So we're focusing on one group here, the rotator cuff, which means with these 4 exercises, we only need to do 5 repetitions of 5 of each exercise per week. And that is enough for the muscles to get stronger. And that's what we want to do here. We want to do the minimum that we can do to get strength. Why? Because of the pain. So if we keep on doing too much, the pain's going to increase. But if we just do that perfect amount, which is good, do it correctly, and get those muscles to become stronger, then that pain is going to come right down over the next few months. That is the goal here. So like I said, 5 repetitions or 5 sets of each exercise per week. Okay? So that means you can split it up into 1 set of each every day, Monday to Friday, if you want. Or you could do 2 on a Monday, 2 on a Wednesday, 1 round on a Friday. Or you could do 2 rounds on a Monday, 3 rounds on a Friday. However you want to do it. We're going to go through each exercise, and I'm going to do 5 of 5 so that I can show you what a challenging repetition and set really looks like. The most important thing is that after each round of 5 of the exercise, not of the whole set, of each exercise, you feel the muscles fatiguing, you feel tired. And the best way you'll know that is if in your head you say to yourself, wow, I could only do 1 more. So when you get to the 5th movement, if you do that 5th movement and in your head you're thinking, wow, I could really only do 1 more, that's how you know you have pushed them to fatigue. If it's feeling quite easy and you're thinking, I can do another 10, do another 20, it's not challenging enough. Okay. So think about that. We say like, how could you do one or two more in the back of your head? Just keep that in mind. Now let's get into the demonstration. So for the purposes of it, I'm just going to use resistance bands. It's what I've got. It's what I use out here when I exercise. So we're going to go with these. I am going to take a heavier one because that's what I would use. That's what will be challenging for me. But for you guys, you have to figure it out. It could be half a kilo, could be 1 kilo dumbbells, could be the lightest resistance band. It's whatever your body is comfortable with right now. Okay, so start as low as you need to go. We're going to focus on 4 movements of the rotator cuff, which are rotation movements. I'll stand back a little bit. So you've got rotation of the shoulder, either in or out. You've got the elevation of the shoulder, which you can do coming forward. You can do it coming to the side, but you've got that whole movement up. The other thing that it helps with is pushing and pulling, closing the door, opening the door, basically. So this could be a push up and this could be like a row. But we're going to do dumbbell and band variations to start us off with. And like I said, the beginner, intermediate, and pro of this is just making it challenging, increasing the weight as it gets tougher. We're going slower, taking more time with the exercise as it gets easier as well, okay? Showing that complete control. But let's begin. So with the resistance bands, you need to connect it and pull it in that opposite direction. That's what you need, the resistance to be in the opposite direction you want to go in. So you can actually use it yourself as the resistance for a lot of cases. So we'll do that. So if we're going to do the external rotation, and this is my effective arm, and this is my anchor arm, I just keep it in there. And I just move that out and bring it back in. There's not a lot of movement here, so you really do have to go slow. That's tough. One, I'll move to the side. So that would be 1 good repetition for me. I'll come to the side here so that you can see. 2, so this is me at my full range. And then you just come back in. Just take your time. Go out as far as you can. And then come back in slowly. 3, so I've got 2 more. So you can see how slow I'm going. Back to the middle. 4. And then the last one. You can see I was like kind of tensing and arching my back. I was recruiting some more help from other parts of my body there, which is a good sense that I was getting quite tired. But yeah, for me, I have a lot of rotation. You'll see I can get it out pretty much the side on. That's considered more abnormal. I'm quite hypermobile. I've got more movements in a lot of my joints. Typically, most people will go from here to about here with external rotation, from the 90 position to about the 45 position. That's kind of the way we look about it, 45 degrees of movement. You might have a lot of movement like me. You might have slightly less, but you'll feel it when you get to the end. It's like kind of, there's no more to go. So that's the first one. So that would be 1 round. So you would want to do 5 rounds of 5, and that would get you up to 25. So you could just do 1 round, or you could do 5 in one go. We'll just do 1 round of each for the purposes of showing you it, but that's 1 round of 5. That's what it should look like. Move on to the second one. So we will do the rows now. I'm attaching this here. You can see I'm attaching it onto like a pole. Yeah. So I can zoom in here. So I'm attaching it onto a pole. This is my affected shoulder. Get it to be nice and tight. And you just want to pull your arm back as far as you can. And squeeze that shoulder blade. And then let it go forward, slow. That is 1 repetition. That would be 2. And you can see I'm taking my arm really far back, squeezing the shoulder blade, and then going really slow on the way out. You can count it. You can maybe do 3 seconds. 1, 2, 3. Hold. 1, 2, 3. That's me on 4. So I've got 1 more to do. Hold. 1, 2, 3. And if you're using dumbbells, go this slow. You want to really go slow through the whole process. Focus just on using those muscles. So we've done a round of 5 of the pulling exercise or the rowing exercise. We've done a round of 5 of the external rotation exercise. Now I'll show you how to do the push exercise. Again, you just want to tie the resistance band to something. I was facing towards the band. Now I'm going to face away from the band. So let's just say that this is my sore one this time. You're just going in the opposite direction. Now you're pushing, as if you're saying to someone, hey. All right, that's what we're doing. Hey. So you're going to do it nice and slow, just like all the other ones. And again, the goal is to push forward, get it about up to 90 as you can. And then you hold and you let it retract slowly. That's you done one. Up as high as you can, hold. And that's two. And this could be a door handle as long as the door is closed. Make sure the door is closed or locked if you're using it. And you can just tie it around there and do this for both exercises. Or you can get someone to be the resistance holder. They can hold the band for you. Two. I don't know if I'm on two, but I'm just going to say I am. So here I am holding it up as high as I can, letting it come down slowly. Four. Come down slowly. All the way back. And the last one. All right, so there we go. There's that. And the last exercise we have to do is the elevation. So I'll adjust you a little bit so that I can show you guys. Okay, so for this one, you're gonna have your feet as the anchor. Whichever side is your affected side. That's what you're gonna stand on. You can see I've got my foot on it here, and this is my sore shoulder on this side. You can see my foot is the anchor. Okay, so that is the position. I'm just showing you that because I'm going to put the camera back to the position where I can walk you through the exercise. Still getting used to this exercise filming. So this is the final exercise of the round. Super simple. So you have two options. You can either come forward or to the side. They're both relevant. In this scenario, we are going to do going forward. So you can see the band is here. I've got my arm here. And the goal is to get this. That is full range of motion of your shoulder. That is what we want to get it to. But you'll find that particularly if you have an increase in your pain, the pain has come on very recently, you'll find that 90 is probably your maximum. So that's what we'll go through. You want to start by getting to 90 and then holding it there and coming down. That's one, if you can only get to 90. And then the other options you have are in between. So you can maybe only get to here, coming down. And then the last one is obviously full range. When it comes to elevation, make sure that you can do the full range with the band or the weight that you're using before you increase it. So if you're using a 1 kilo dumbbell, half a kilo, or the lightest resistance band, make sure that you use it all the way up top, right? Super important. So now let's just go through a set so that you can see what it looks like. All the way up as high as I can, the resistance band, pulling it down, hold that. One. High as I can. Hold it at the top, make sure my arm is straight. Slow. Two. That was a bit fast, but don't do that. Holding it and then down. Look how slow I'm doing this. You'll feel this a lot when you take it really slow on the way down, particularly with the resistance band. But even with the dumbbell, because you're holding it against gravity, so it's still challenging. And then one more. Let's go really slow on the way up. And then I'm up at the top. And I'm coming down. Down. There you go. Right? That is how easy it is. So you could do a round like that Monday to Friday or 5 days out of the week, or you can do it 2 rounds one day, 3 rounds another. Remember, for each exercise, you want to do 25 repetitions total per week. So split that up however you like. As you get to feel more confident and the exercises get easier and they don't cause you much discomfort, you increase the weight. Once you can do 5 rounds of 25 repetitions at the highest weight you can possibly do, there is no discomfort in your shoulder. You're going nice and slow. You're pausing for 1 second at the top, lifting and moving for 2 to 3 seconds, and controlling it for 2 to 3 seconds on the way down. Then increase the repetitions. So you can go from 25 to 35 per week. And then once you're comfortable at 35, you can go to 40 per week and 45. And once you can go from being able to do 25 repetitions per week at the lightest weight you can handle to 45 repetitions per week, minimal discomfort at a much higher weight, you will see that your shoulder day to day is doing a lot better. You will have minimal to no pain. You will have no restriction in your movement and you'll be functioning super well. You may feel it sometimes in the mornings with all the activity that you're doing, but it's nothing limiting anymore. And the best way you can keep track of this is by having some sort of pain diary. So you just want to get it out, get something open, and then write down the date, today's date, and then the exercise names. So you've got push, pull, rotation, elevation. Super easy names. And then you're going to say how many you did. So you would say 5 repetitions for 1 set, 5 repetitions for 2 sets, however. And then you want to know how your pain was during the exercise. So we're going to score that pain anywhere from 0 to 10. 10 is cut my arm off, it's so sore. 0 is I don't feel anything. All right, so put it somewhere on that scale. What we're looking for is anywhere between 0 and 3 during the exercise. We don't want to push it too much. If you do feel like your pain is increasing, then that's when you have to do those range limitation factors that I was talking about. If it's elevation, don't go too high. If it's rotation, don't need to go all the way out. Or equally, you could just reduce the resistance a little bit. But play around with those factors, but you're aiming to get between 0 and 3 pain. Why? Because you're also going to record your pain the following morning. And that is why we want to keep it between 0 and 3, because if you push it too much, maybe 4, 5, and beyond, you'll find that next morning it's really sore. Because again, it's that idea of just doing too much too soon. And we're trying to control that. We're trying to take back that power and build the strength without increasing the pain too much. And that is the key here. We're getting the maximum strength benefits possible for the muscles without increasing the pain too much, because they're not necessarily directly related. Because like I said, we don't know exactly where the pain is coming from. It can be coming from a lot of different regions. So this is the best way to do it. So it is quite precise, but it's good. It keeps you focused. And you record that every time you do it. And that means that week to week, you'll be able to see, is my pain going down? Am I lifting heavier? So yeah, also add a little column in for the resistance. So just write resistance, whether it's the yellow band or whether it's 1 kilo, just write down the resistance that you're using and track all of those things. And then you can look at it week on week and you'll see the gradual improvements. And that is what we're looking for. Also have a little note column at the end. So you'll have the date, the exercise name, the amount of repetitions, the weight that you're using, and the amount of sets as well. If you're doing 1 set or a 5 or 2 sets of 5 or whatever, the weight that you're using, the pain experienced during, the pain the morning after, and then also some notes. So maybe just a little N and just write down, how did it feel? Was it easy? Was it challenging? Was your shoulder tight? Any sort of little notes that you can think of, little cues, that just comments that you have about it, write it there. And that is the easiest way to track it. So yes, track it however you want. That's the best way to do it, especially if you're following my program. Maybe you're not actually seeing any therapists or anything at the moment. But if you do want to do this program and you are regularly seeing your doctor or your therapist or your chiropractor, just ask them about it to make sure that they're okay with you doing it. Most likely they will be, though, because it is safe to do, because you're just following the principles of strength and conditioning and keeping the pain under control. That is everything from me, guys. Please let me know in the comments below how you're getting on with the exercises. Have you found this helpful? And have you enjoyed this series in general? I split video down into 3 parts. Let me know what you think about doing that as a whole. And then also there's some bonus footage because I'm filming this part on a separate morning to when I did the intro to this video. And yeah, you'll see in the bonus videos why I had to do that. But thank you so much for joining me in this wider series. Hope you like and subscribe to the channel, of course. And And yeah, let me know what other topics you'd like me to cover. I would love to cover anything about pain, injury, and recovery. So let me know what's bothering you, and then I'll make a video about it. And it can start to get a bit frustrating. The therapist will probably disagree and they'll be like, oh no, I see progress, because they can see it, how it's changing over time, especially when they see you 1 week and then 2 weeks later. But you individually won't be. And if you're following this program, then you're maybe not actually seeing anyone at the moment. So this is the best way that you can start to see it, because you'll go back to the diary and you'll see, oh, I did this 2 weeks ago and it caused a lot more pain. I was a lot more apprehensive. I was quite confident with it this time and it was quite easy. So that's how you can see it yourself. So do that, track the progress. Let me know in the comments below how it's going. And of course, if any of these exercises are causing you a lot of pain or discomfort, remember, go and talk to your doctor, go and talk to your therapist, go and talk to anyone you can about it, and just make sure that there's nothing else that you need to worry about here. All right? Keep the pain under control. You should be okay though. There you go. That is everything that you need to know about non-specific shoulder related pain, what we're not calling it anymore, why it happens, what we think anyway, and what you can do to start recovering from this type of pain. Thank you so much for joining me in today's video and hopefully in this wider series. And if you haven't already watched the other two videos, click up here and watch them right now.